I'm going to take vitals on this 3-year-old gelding here. We're going to start by taking his temperature. Always use a digital thermometer, lube it up with some Vaseline, and this is important to be able to tell if your horse has an elevated temperature and is harboring an infection. So it's very important for your vet to know this. So we're going to start by coming back here, and most horses, if you lift up their tail right here, they're gonna lift it for you. So we are going to insert our digital thermometer right back here, and we are just going to wait for it to do its beep, and we'll get a good temp here. Seems to be at 99.5. So that's within the normal limits. Should be within 99 to 101. Next, we're going to check the heartbeat. I have a stethoscope, which is good, isn't needed per se. You can do it other ways. You can take a pulse behind the chin here that I'll show you, also some distal pulses. But we're going to listen to the heartbeat right down here. You're going to use a second watch or a timer, and you're going to count out how many times you hear the horse's beat in 15 seconds, and then we're going to multiply it by 4, or you can listen for 30 seconds and multiply it by 2. So. I got 8 beats in 15 seconds, so that's 32. Normal rate is 28 to 44, give or take, for this guy, so that's within the normal limit. Again, we're going to check right back here on him. What we're looking for is there's an artery right behind back here that you can press. Sometimes it takes a little getting used to, but you can feel it. It may not be as strong as the heartbeat down there, but you can feel it. It just takes a little bit of practice getting used to it. And so you would also count that off for 15 seconds and see what you get. The other spots are also on the distal pulses here. And it's right on the back side. Right back here. I find this one actually harder to palpate, but it can be done. It just seems quite a bit weaker. Another good thing to remember is never take a pulse with your thumb, because your thumb actually has a pulse in it itself. So always use your first 2 fingers to feel that. And I do feel one there. You can feel on all 4 feet, and they may not be equal, but they should. What we're going to do next is respirations. Spots that you can check these is watching their flank and also counting for 15 seconds or 30 seconds. Horses don't breathe an awful lot, so the respirations at a resting rate are usually pretty small. So. And I got 4, so that was 16 that we got there. And the other spot you can do is you can also check the nostril flare on him, and you can count that as well. You don't want to put your hand right up by him, because if you have something on your hand, it's going to draw your attention to the hand. A couple other things is you want to check for hydration in the horse. So you're going to do a pinch test. And right up here is a good spot to do it. What you're checking for is the how much hydration is in the skin. So if you pinch right here and you let it go, it should return back to normal within 2 seconds. So guy right here. 1, 2, which is good. And if it doesn't return back to normal, you just count for as long as it does. And that makes sure that your horse is hydrated. The other thing we want to look at is the mucus in the mouth to see what the gum color is. On this guy, put you on my mouth here. Alright. So we're just gonna lift up. He's got nice pink here. Alright, that's good. The other thing you can do is you can, we're gonna do like a capillary refill on his gums here. You're gonna press in, it's gonna go white, and then it's gonna return back to pink. So press white, go back to pink. That's good. And you check the bottom as well. It's got good healthy mouth here, bud. So by doing all of that and recording all the data, you give your vet a good baseline information on what could be wrong with your horse.